Well, it has been a year like no other. An entire generation of students have had their education disrupted from junior kindergarten right straight through to post-secondary. No one has been spared from the reality of the global pandemic COVID-19. Now, classrooms have been shut down since mid-March, and here in Thunder Bay and across northwestern Ontario, school boards, universities, and colleges are preparing for some kind of reopening in September. All will be working closely with the district health units to make sure it's done safely with strong protocols. Dr. Janet DeMille, Medical Officer of Health with Thunder Bay District Health Unit, on the line. Dr. DeMille, good morning.
Good morning, Lisa.
Wow, what a crazy couple of months for you and your team.
Oh, yes. I don't know. It's hard to imagine what life was like a year ago or even 6 months ago. So much has changed and, so much is still going to happen, right? And as we navigate this together, so it feels... it's a different world right now.
So let's get to it now. With schools planning those staggered reopenings coming up.
Yeah.
So what are you doing with school boards, first of all?
Well, a lot, actually. And I should know, we've been working with school boards throughout the course of this pandemic as we've navigated this and, of course, anticipated the reopening of schools at some point because we knew that this is something that really has to happen. So, this is building off the work that we've been doing with them in the last couple of months, but even over the last 6 months. And, the government introduced the framework or the guidance for the reopening of schools. That was at the end of July. And that really lists, the series of measures that if a school is, if every school is kind of looking at each one of those measures and implementing in that in their school, in the school setting, that will really help, mitigate the risk of COVID-19 in that school. And so we've been, and that guidance document is fairly sort of high level, and it has to be really operationalized in each and every school in our area. So we have a team of people, really. We have our Healthy Schools team and the public health nurses and other public health professionals. We have additional sort of public health infectious disease nurses who are contributing to that, and our public health inspectors who have really, done a lot of the support for implementing measures in the businesses as they were reopening. Mm-hmm. And many of them, many of the measures are the same sorts of things. It's a different context, of course, of the schools. So, we have a lot of resources really working with the schools on this. And not only that, like myself or the manager, we're still very much connecting with the province because we're waiting both from the Ministry of Health and Ministry of Education for some of the more detailed guidance on certain things that we will need to have those details in order to implement some of the measures, especially those as it relates to, what's going to happen when there is COVID in the school, or what are we going to do with individuals who may have symptoms that could be COVID, and of course, the parameters around who needs to be tested, and all of that detail really, in the process of being worked out, but a lot of work is certainly happening.
And that's, I think, the question. Let's say you've got that school open, and it's a primary school, and you've got a child who is presenting symptoms, or a teacher, or a support staff. What happens?
Yeah. So very, very fundamentally, the general rule, of course, for anybody is if you have symptoms, especially any new or worsening symptoms that you have, you should stay home. You should isolate because we know that could be COVID-19. And we know even it's, with children, they could have really mild infection and not show very much symptoms. So it's really important to kind of keep COVID-19 out of a school or any setting. And so we ask, people to screen themselves and to not come in. And, one of the biggest things is access to testing. So if somebody gets tested and they get the results and it's negative and they're feeling better, they have no more symptoms, they can return to that particular setting. So it's really putting together the guidance. I mean, in many ways, the kind of guidance is going to be similar to what we use in all other settings and even workplaces are using. But the details of it and how do you assess children, especially young children, who may have various little symptoms most of the time and who may have mild sort of COVID. So those, we're looking for, the guidance from the province on that. Basically, this is one area where we're really looking for the experts in pediatrics and in infectious diseases to kind of be the guidance on it and making sure that it's sort of a consistent approach across the province.
Yeah, because, I'm thinking like that won't be just the one child in the class. They might have siblings, they might be sitting close to somebody. Family members, there's a whole series of people who might be impacted.
Well, absolutely. And, one of the things is, if somebody's sick or if somebody has COVID, then you have to kind of isolate everybody who's close, right? Who's close contacts, which is the household. So there are significant implications, right, to the child and their learning and, their ability to attend class, but the family and others. And of course, if, the parents might be working, right? And if they're not able to attend work, then that impacts that particular workplace as well. So it is quite complicated.
It really is.
We're trying to navigate through that.
Yeah. So what about the turnaround time for testing? Earlier this week I talked with Dr. Sarah Newbury in Marathon and the mayor there, Rick Dumas, and they were saying 7 days for a turnaround. I know everything has been moved to the hospital in terms of testing. What's happening?
Yeah, so one of the ways we manage this pandemic, of course, an important way is the testing, and people, need to have quick access to testing when they have symptoms or when they've been exposed, for example. But we also need to get that test result back very quickly. And right now, there's certainly sort of issues or challenges around that, and especially in communities like Marathon, where there may be sort of additional factors like the transportation and that can be impacting that. And I know that there's a lot of work being done both provincially and regionally about that. It feels, and I'm not directly involved in that, but we do kind of watch that turnaround time, and I really do hope to see that improve. Certainly for communities like Marathon fairly shortly, because it does have a ripple effect, right? If we don't have that and even for the purposes of when there is a positive case, we want to follow up really quickly on somebody, and we don't want them necessarily waiting for 4 days to find out what they're positive, because if they haven't necessarily been isolating, then they could have exposed more people. So turnaround time, absolutely fundamentally important as part of this, and continuing to work on reducing that and advocating for that to be addressed.
Now, this morning we heard Premier Doug Ford saying he was in consultations with Shoppers Drug Mart, Galen Weston, about getting sort of quick testing in pharmacies. Has that been on your agenda?
You know what? I see sort of opportunity. I know other jurisdictions have implemented stuff like that. I also really would like to know more about some of the quick tests. We have what we're using right now is actually a diagnostic test. It's largely used to diagnose people who have COVID, and we're using it as sort of broad-based screening. But there's other ones where there's a much quicker turnaround time. Would really see the benefit of that for even people being able to have quick access and a quick result. I think that's really another opportunity that we have. I'm not really sure, where that's at. I do know that there is work being done on it, but I don't know where it is in terms of being implemented and where I could see that benefiting us down the road. Just not sure where that's at. Are
you still using the nasal swab? Is that the testing regime?
Yeah, that is. So the notable one is a nasal pharyngeal swab. So it goes in the nose, and there are other swabs that can be used, but they're less maybe accurate. But it is all a swab in that area.
Okay. What about testing supplies? Because right now you also have to be preparing, I guess, for, use air quotes, second wave, PPE, testing agents. I mean, that's a lot to keep up with as well.
Yeah. Yes, and so that fortunately isn't me that has to do that. So I know that there's, I think this is an example of where we're in a lot different situation than we were back in March, is that there's work groups even sort of regionally through like in Ontario Health North, for example, and provincially that are working on this. And I think, what I'm hearing is very sort of positive about the kind of supply situation. But you know what, you just can't, you always have to keep working on it and ensuring there's that supply, making sure that there's the swabs are available everywhere that need them. And of course, even the capacity to do the tests and the various cartridges that people need for the labs that analyze the test, but also, of course, the personal protective equipment, which, for healthcare workers, for example, is a big one. Mm-hmm. And, teachers are also going to be in schools needing personal protective equipment, so a little higher level than just the standard face mask. So, yeah, there's a lot, a lot of that, those resources definitely need to keep an eye on them and make sure that they're, available.
Thank you and your team for the good work you do.
Thank you very much, Lisa.
Take care.
Appreciated.
Okay, bye-bye.
Bye-bye.
Dr. Janet DeMille, Medical Officer of Health at Thunder Bay District Health Unit.